co-chair of the Canadian Association of Pharmacy for the Environment.
Thank you so much. It's lovely to be here today. And when we think about pharmacy professionals, you might be thinking about, your pharmacist at Rexall or Shoppers. The one thing I want to talk about very briefly is to say that pharmacists are involved. Whenever you think about medications, you have some kind of pharmacist involvement. So from the drug development stage to pharmacists working in industry, to your hospital specialized pharmacists. I've been an oncology specialized pharmacist for about 10 years or so, to your community pharmacists, and then also pharmacists who are working in regulatory bodies as well, which is a super critical area for this work. There are also pharmacy technicians as well who do some really excellent work. Why is this important? Well, we know that the healthcare system globally has a bigger emissions burden than even the airline industry. I say even because that doesn't give the airline industry a free pass. And medications count for 1/4 of all of these emissions. In fact, now we're starting to see that it might end up being at least 1/4. And that's why pharmacy professionals are now, we were on the front line of COVID, and now we are also on the front line of the climate crisis, particularly on both mitigation and adaptation. So for mitigation, we don't know anything about buildings. Sorry to engineers here. So I put that in gray. But we do know a lot more about, so one really good example is medication waste. So if you think about an inhaler, Sejal, I think, referred to this earlier, and the patient comes to the hospital, they get dispensed an inhaler, then they go to another ward, and then the nurse asks for another inhaler, and then they get another inhaler. So by the time a patient kind of goes through 10 days, they might end up getting 3 or 4 inhalers, which means that the Ottawa Hospital did a study showing that only 8% of inhaler doses were actually used, which is why you need pharmacists and pharmacy technicians involved. We found that by cutting inhaler waste by 20%, you could save a trip around the world 32 times. So another area, medication waste reduction also leads to cost savings, which is really exciting too. Another area is a life cycle assessment and procurement in general, which I won't spend any time on. I think Harsha did an amazing job there specifically, but you have pharmacist involvement there, particularly with interaction with regulatory bodies, which is really, really critical. And then you have your medication use. So we have a great presentation that has been heard today by Anita Rao on desflurane. We are also very involved with regards to inhalers, both with regards to inhaler technique, wastage, education, and really looking at the difference in emissions there as well. And we have a big role to play in deprescribing as well. As an oncology pharmacist, I've seen kind of the front lines with regards to the whole concept of thinking about end-of-life care, and pharmacists have a big role in deprescribing. In terms of adaptation specifically, we have the strengthening of supply chains more broadly with regards to pharmacists' involvement in various areas. And then also tied to that are disaster planning recommendations that you need specifically for pharmacy, for hospitals, for community pharmacies, and for regulatory bodies as a whole. There are equity considerations for all of these things. So in terms of some of the work that various groups have done, there are specific recommendations for disaster planning with regards to climate resilience, looking at everything from inventory management to staffing to electronic infrastructure to communication processes, et cetera. One thing I briefly want to talk about is medication management and medication stability. So you have situations where you have a patient who doesn't have air conditioning and their medications are laying around, and now you have an extreme heat event. What are you going to do? But you also have situations where you have a patient who's on a diuretic, or they're on lithium, or they're on a medication that helps prevent sweating. So community pharmacists and hospital pharmacists can be really involved in recommendations here and in monitoring as well. A lot of you may know this graphic already with regards to climate's impact on various areas of illness, but I just wanted to mention this very briefly to show the impacts with regards to hospital pharmacy. And then I just wanted to leave you by showing, this slide makes me happy. So, so what CAPhE does specifically is, the Canadian Association of Pharmaceutical Environment, is that we liaise with pharmacy-based organizations to help them bring in planetary health, and then we liaise with climate and health-based organizations to help them bring kind of pharmacy and medications as a whole. And we've been involved with everything from education and awareness to advocacy and system change. We've had some good advocacy wins, which we can talk about offline as well. Yeah, if you want to hear more about CAPhE, feel free to contact me afterwards. I promised somebody that I would mention this. So CAPhE has had individuals both on the medication management technical committee as well as the climate, the wider climate advisory committee for HSO. It's really exciting being involved with HSO because you really feel like you can be involved in system change as well. And again, always bringing in subject matter experts in a multidisciplinary way is just really critical for this area. Thank you.